Before performing any care procedure, what is the first action a CNA should take? A. Gather all equipment. B. Wash hands. C. Put on gloves. D. Explain the procedure. Answer, B. Hand hygiene is always the first step to prevent infection transmission before any patient contact. When assisting a resident to ambulate with a gait belt, the CNA should place the belt A. Around the resident's neck. B. Around the resident's waist. C. Under the resident's arms. D. Around the resident's chest. Answer, B. The gait belt should be placed snugly at the waist to provide safe support during ambulation. What should a CNA do if a resident begins to fall during transfer? A. Try to hold the resident upright. B. Use the gait belt to catch the fall. C. Gently guide the resident to the floor. D. Step away to avoid injury. Answer, C. The CNA should control the fall by lowering the resident to the floor safely, protecting both parties. When communicating with a hearing-impaired resident, the CNA should A. Speak loudly directly into the ear. B. Turn their back while talking. C. Face the resident and speak slowly. D. Use gestures only. Answer, C. Facing the resident and speaking slowly helps with lip reading and comprehension. What is the correct way to measure a resident's radial pulse? A. Place thumb on the wrist. B. Use fingertips on the thumb side of the wrist. C. Count for 10 seconds. D. Use the palm of your hand. Answer, B. Fingertips are used on the radial artery, thumb side, for 60 seconds to measure an accurate pulse. Which of the following tasks can a CNA perform? A. Administer insulin. B. Change sterile dressings. C. Measure and record vital signs. D. Give medications. Answer, C. CNAs are trained to record but not interpret or administer medications or sterile procedures. When repositioning a resident in bed, the CNA should A. Keep the side rails up. B. Use proper body mechanics. C. Avoid asking for help. D. Pull the resident by the arms. Answer, B. Proper body mechanics prevent back injury and ensure safe repositioning for both CNA and resident. What is the most important action to take when caring for a resident with Clostridium difficile? A. Use alcohol-based sanitizer. B. Wear gloves only. C. Wash hands with soap and water. D. Avoid entering the room. Answer, C. C. Difficile spores are resistant to alcohol, only soap and water effectively remove them. A CNA notices a resident crying quietly after lunch. What should the CNA do first? A. Ignore the behavior. B. Ask the resident if something is wrong. C. Report it immediately. D. Offer to turn on the TV. Answer, B. Emotional distress should be addressed compassionately by talking to the resident first. When transferring a resident from bed to wheelchair, the CNA should ensure that A. The wheelchair brakes are locked. B. The resident's legs are crossed. C. The footrests are down. D. The bed is raised high. Answer, A. Locking brakes prevents wheelchair movement, ensuring safe transfer. When performing oral care on an unconscious resident, the CNA should A. Use a regular toothbrush. B. Turn the resident on their side. C. Use mouthwash only. D. Insert fingers to keep the mouth open. Answer, B. Turning the resident prevents aspiration during oral care. A CNA finds a resident on the floor. The first action should be to A. Move the resident back to bed. B. Check for responsiveness and injuries. C. Call the family. D. Complete paperwork. Answer, B. Assessing for consciousness and injuries ensures immediate safety before reporting. What is the main purpose of using standard precautions? A. To protect only the resident. B. To protect only the CNA. C. To prevent the spread of infection. D. To save time. Answer, C. Standard precautions protect both caregivers and residents from potential infection transmission. Which statement best describes the role of a CNA? A. Plans the resident's care plan. B. Provides hands-on care under supervision. C. Diagnoses illnesses. D. Prescribes treatment. Answer, B. CNAs provide direct care under the guidance of licensed nurses. A resident with dementia becomes agitated during care. The CNA should A. Stop and return later. B. Restrain the resident. C. Shout for help immediately. D. Ignore the behavior. Answer, A. Pausing care and trying again later helps reduce stress and maintains trust. When recording intake, which item must be included? A. Water. B. 4 fluids. C. Soup. D. All of the above. Answer, D. Intake includes all fluids consumed orally or intravenously. If a resident complains of chest pain, the CNA should A. Give them water. B. Report immediately to the nurse. C. Take their blood pressure. D. Wait to see if it goes away. Answer, B. Chest pain could indicate a serious emergency. Prompt reporting is vital. Proper perineal care helps prevent A. Pressure ulcers. B. Urinary tract infections. C. Constipation. D. Skin dryness. Answer, B. Perineal care removes bacteria that could cause urinary tract infections. When should gloves be changed during care? A. Between each resident. B. After 10 minutes. C. Only if torn. D. Once per shift. Answer, A. Gloves must be changed between residents and procedures to prevent cross-contamination. A resident with diabetes refuses breakfast. The CNA should A. Insist they eat. B. Notify the nurse. C. Remove the food. D. Offer dessert instead. Answer, B. Skipping meals can affect blood sugar. The nurse must be informed immediately. A CNA should identify a resident before providing care by A. Asking their roommate. B. Checking the ID band. C. Calling the resident by name only. D. Asking a family member. Answer, B. Verifying identity via the ID band ensures correct care is provided to the right resident. When assisting with a bedpan, the CNA should ensure A. The curtain is closed for privacy. B. The head of the bed is flat. C. Gloves are not needed. D. The door remains open. Answer, A. Maintaining privacy promotes dignity during elimination. When applying elastic stockings, it is important to A. Apply them while the resident is standing. B. Remove them every 8 hours. C. Check for wrinkles or folds. D. Pull them tightly. Answer, C. Wrinkles can cause pressure and impair circulation. A CNA overhears another staff member gossiping about a resident. The CNA should A. Join the conversation. B. Report the behavior to the nurse. C. Ignore it. D. Tell the resident. Answer, B. Breaching confidentiality violates residents' rights and should be reported immediately. When caring for a resident with an indwelling catheter, the CNA should A. Keep the drainage bag below bladder level. B. Hang the bag on the bed rail. C. Disconnect tubing frequently. D. Position the bag above the bladder. Answer, A. Keeping the bag below bladder level prevents backflow and infection. A resident reports that their dentures are missing. The CNA should A. Ignore it. B. Search the immediate area. C. Blame another staff member. D. Wait until family arrives. Answer, B. The CNA should search, then report to the nurse so appropriate follow-up can occur. Which is a sign of a pressure ulcer starting to form? A. Red, warm area on the skin. B. Open bleeding wound. C. Cold, dry skin. D. Bruising. Answer, A. Persistent redness that does not fade indicates early pressure injury. When measuring urine output, the CNA should A. Estimate the amount. B. Measure in milliliters. C. Use any container available. D. Record only when over 500 milliliters. Answer, B. Accurate measurement in milliliters ensures proper monitoring of fluid balance. A resident is on a restricted fluid diet. The CNA should A. Offer drinks freely. B. Record all fluids consumed. C. Only track water intake. D. Ignore fluid restrictions. Answer, B. Monitoring and documenting all intake helps ensure medical orders are followed. When providing care for a dying resident, the CNA should A. Avoid entering the room. B. Provide comfort and respect. C. Discuss personal beliefs. D. Rush through tasks. Answer, B. Compassionate and respectful care supports the resident's dignity during end-of-life care.